Favourite part of the morning. It's Ask the Doctor, ladies and gentlemen. Anything you want to ask at all. We've had all sorts of questions fired at the doctors. So, Max and Jonquille, you are... What's that noise? Is that you drilling? That's quite eerie, isn't it? Ooh.
Just finishing off these last polishings of the teeth now. They're looking
Brilliant.
great.
Well, you make all the noise you want. OK. Right, so we should have Dave in the audience. Where's Dave?
Hey. Hello.
How are you, Dave?
Not bad, you?
If you can hear me over the drilling, Jonquille and Max are here. What's your question, pal?
Well, basically, I've got a problem with man boobs, or moobs, as I like to call them. Is there a procedure that I can have, you know, to get rid of them or just to reduce them? And if so, can you get it done on the NHS? Because it is knocking my confidence quite a lot. With the size of them, when I'm wearing T-shirts and stuff, they are very noticeable, and it's something that, you know, I'd want to, as you can see there. So,
is that you?
Confidence.
Is that you?
Yeah. Unfortunately, yes.
Jonquille?
Can I ask you how old you are?
26.
And how long have you had how long has this bothered you for?
Years.
So
years.
since teenage years, since puberty?
Yes, I lost quite a bit of weight, and since then they've actually turned into what I call proper breasts, or moobs.
Okay.
So, you know, it
and on a
knocks me
serious note,
self-confidence.
and fair play to you for asking the question, on a serious note, horrible to have to deal with.
Yeah, absolutely. There's various different causes for what we describe as moobs. The formal term is gynaecomastia. It's important to know when it actually started, because if it's in puberty, it tells us as doctors that it's more likely to be a hormonal component, so actually there may well be a high percentage of breast tissue present there, whereas later on it tends to be a high percentage of fat, which is easier to remove. Okay. The other important things causes are steroid use, some drugs, and alcohol use can cause...
Do you take steroids?
No.
No.
I'd be a lot more buff than this if I did.
Okay.
Do you drink excessively?
No, not excessively, no.
OK.
So this could be the hormonal thing you're talking about?
It could well be. Is there any family history of male breast cancer in your family?
No.
No. OK. So you rule out all the important causes.
Yeah.
There's a couple of things that you could actually have done. Either a liposuction technique to remove the fat from around underneath the nipple, but then we need to target the breast tissue that's sat underneath the nipple. That can be actually removed with liposuction or minimally invasive liposuction. Or there's a procedure where there's just a small incision into the nipple, just around the areola, which is the base of the nipple, and removing the gland tissue.
Is that something that they do on the NHS?
Yes, they do.
They would do that on the NHS, right.
You need to see your GP for advice on that.
Particularly because it's causing you, upset and psychological distress. You can, even though it's considered to be like an aesthetic piece of surgery, if it's having a real impact on you and how you feel and your day-to-day functioning, then it can be justified on the NHS.
Fair play, though, mate. It answers your question. Fair play to you. Where's Gemma, if we can move on? How are you, Gemma?
I'm good, thank you.
Hello, darling. What's your question to the doctors?
I used to use sunbeds quite a lot, but I was persuaded to stop, and I have stopped. I don't use them anymore. And also, I've heard about the tanning jab. I would like to know more about it.
Max? A tanning jab?
There's a jab you can take. I don't know about the
I've never heard of that in my life.
The injection, I mean, you could... I have to say, this is not licensed in the UK, and I absolutely would not recommend you doing this, and I shall tell you why. It's called melanotan, and it's a synthetic chemical they're usually made abroad, and you buy them. It comes as a powder. You have to make it up yourself, and you then inject it, and then it stimulates the skin's the cells in the skin that make your skin dark. Yeah. Now, there are a number of problems with this. Firstly, nobody knows the long-term consequences of it. There is a theory that it may well lead long-term to skin cancer development. Nobody knows.
All right.